Hello and welcome to the Practical Hypnotherapy podcast. My name is Dr. Tom Christie. I'm an independent author and researcher based in central Scotland. Joining me today is Dr. Colin M. Barron, who is the author of Practical Hypnotherapy. So Colin, how did your book come about?
Thank you, Tom. Well, I've had a rather interesting career. I studied medicine at Glasgow University and ended up as a junior ophthalmologist. I had to give this up because of problems with my own eyesight, and I ran a private nursing home with my first wife between 1985 and 1999. When we sold the nursing home in 1999, I realised that I would have to do something else to earn a living. So I retrained as a hypnotherapist, largely because I have had a lifelong interest in the subject. My late father, Dr. Peter Barron, was one of the first GPs in Scotland to learn hypnotherapy back in 1960 with the British Society of Medical and Dental Hypnosis. For a decade, my hypnotherapy practice was very successful, but from the late 2000s onwards, various things happened which, in combination, forced me to close down my hypnotherapy business in 2016. First of all, there was a vast increase in the number of people providing hypnotherapy services in my local area. When I first started as a hypnotherapist in 1999, there were just 2 or 3 hypnotherapists in the formal central region, comprising Stirling, Alloa and Clacks. Now there are about 50, including 15 in Stirling and 5 in Dunblane, where I live. There are actually more hypnotherapists than plumbers in Dunblane, which is a small town. The next problem was that my personal life was ripped apart by a number of calamities. My second wife had a very severe stroke and retinal artery occlusion in 2011, which has left her profoundly handicapped. And then in 2015, I suffered a massive heart attack, which put me in hospital for 4 months. My business was affected by other factors. I used to make a lot of money from training people in thought field therapy, but changes in the way TFT was taught internationally, the introduction of distance learning packages and so on, meant there was no demand for my services. So I conducted my last TFT training in 2011. I had trained in a form of TFT called Voice Technology, VT, which enabled me to treat people worldwide by telephone. But the introduction of relatively cheap voice technology training courses meant that demand for my VT services slumped to almost zero. The private hospital in Glasgow, where I used to see some patients, unilaterally cancelled their contract with me because I wasn't seeing enough patients. My business started making losses. So because of all these factors, I closed down my hypnotherapy business in April 2016. This was quite a blow because I'd originally intended to keep working until my early 70s. By this time, I had started writing books. So in 2018, I decided that I would write a book on hypnotherapy, which was a distillation of everything that I had learned in the last 20 years.
So Colin, what exactly is a hypnotic trance? How would you describe it?
Well, my definition of a hypnotic trance would be a state accompanied by profound mental and physical relaxation in which the focus of our attention moves from the outside world of reality to the inner world of our imagination. And while in this state, any suggestions that are made to us pass into our unconscious mind, where they can have a profound effect on our feelings and behaviour.
Can everyone go into hypnotic trance, or are there some people who simply can't be hypnotised?
That's a very interesting question, and there are different opinions within the profession. In academic hypnotherapy, there is a view that there is a spectrum of hypnotisability. So there are some people who go into trance easily, and others who are near impossible to hypnotise. However, Dr. Milton Erickson, one of the greats of clinical hypnotherapy, disagreed with this view. He pointed out that everyone in the world goes into naturally occurring hypnotic trances, perhaps hundreds of times a day. When we watch a movie, when we listen to music, or read a book, or daydream, or indulge in any kind of leisure activity or hobby. So, how can people say that they can't go into hypnotic trance when they already spend most of their lives in such a state? I think the real problem is that some people will not go into trance when they're in a therapeutic situation. Usually, such individuals have control issues and see going into trance as losing control. It's not a problem I've seen very often. In my 17 years as a hypnotherapist, I've seen it maybe 2 or 3 times. And usually there is a story that the client has been to other hypnotherapists who have also failed to put them into trance. And I think the reason you see it so rarely is that people who are like that know they have this problem, and so usually do not seek out the services of a hypnotherapist.
And what different types of hypnotic suggestion are there?
There are 2 main classes of hypnotic suggestion, namely direct and indirect. In direct suggestion, the hypnotist suggests that the desired change has already happened. So the suggestion is given in the present tense. For example, when you get up to speak, you feel relaxed. It would not be as effective to say, when you get up to speak, you will feel relaxed, because that is future tense. And as far as the subconscious is concerned, that might be 20 years from now. The other class of hypnotic suggestion is indirect suggestion, and is synonymous with the works of the late Dr. Milton Erickson, regarded as the world's greatest hypnotherapist. Erickson realised that direct suggestions are sometimes rejected by the client's conscious mind. So he created various types of indirect suggestion, which get into the unconscious by the back door, so to speak. So, for example, the so-called double bind, such as, will you go deeper into hypnosis as you breathe in or as you breathe out? Or the so-called dependent suggestion. As you listen to the sound of the birds chirping, you go deeper. Erickson was also fond of using metaphors to bring about change, the idea being that they have a hidden meaning which can only be understood by the unconscious. So, for example, if you are treating a client with a fear of flying using a metaphor, you might tell them a story about a caterpillar who looked up at the sky with fear and then one day grew wings, turned into a butterfly, soared among the clouds, and felt relaxed.
So can you explain the difference that exists between a positive and a negative hypnotic suggestion?
That's a very good question. It is easier if I first explain that a negative suggestion is one which contains the word not. And I'll just repeat that because it's so important. A negative suggestion is one which contains the word not. So, you are relaxed is a positive suggestion, while you are not anxious is actually a negative suggestion. since it contains the word not. The reason that this is so is because we believe the unconscious mind resides in the right hemisphere of the brain, while the conscious mind is in the left. Language is a function of the left hemisphere, so one corollary of all this is that the right hemisphere, the unconscious, has no concept of the negative in language. So if you say to someone in trance, "You are not anxious," what the unconscious actually hears is, "You are anxious." What you should say instead is, "You are relaxed." Now this is a fairly simple concept, but you would be surprised how many hypnotherapists, even people who conduct trainings and write books, don't know this. And many of the most popular hypnotherapy scripts contain a lot of negative suggestions.
So can hypnosis be used to stop people smoking, for instance, and how effective would that be?
Hypnosis can be very effective at stopping people smoking. Back in 1992, New Scientist magazine published a review of all the common methods for stopping smoking. And they found that the overall success rate of hypnosis was 30%, which was higher than any other method that had been reviewed. Now, a 30% success rate may not sound very impressive, but nicotine replacement therapy, which is still the main method used in the NHS, had a success rate of only 15%. Incidentally, the least successful method was counselling, which might be just your GP telling you to stop smoking, which only had a 5% success rate. However, in 1990, Harley Street hypnotherapist Valerie Austin created her own stop smoking method, the Austin technique, also known as stop smoking in 1 hour, which involves a 10-step process and which has a 95% success rate, even though most clients only have a single 1-hour session. I myself learned the Austin technique in August 2001 and used it until I retired.
And how about weight control? That's a major issue for many people. How can hypnosis help with that?
Obesity is one of the greatest problems facing the NHS, with 60% of the population being overweight and about 30% being obese. And it's important to understand the cause. For many years it was thought that the problem was too many calories overall and or too much fat in our diet. I once read a diet book which stated that it is the fat in our diet which makes us fat. But a wind of change is now blowing. In 1972, distinguished American cardiologist Dr. Robert Atkins claimed that obesity was caused by eating too much carbohydrate, and that a diet high in fat but low in carbohydrate results in substantial weight loss. Atkins' views have since been updated by others, and the current view among many doctors and nutritionists is that the best diet for weight loss is a high-fat, medium-protein, low-carbohydrate regime, the so-called ketogenic diet. Another discovery is that one good way to lose weight is so-called intermittent fasting. There are 3 ways of doing this. You can skip breakfast and eat lunch and dinner. You can eat breakfast and lunch and skip dinner. Or you can eat normally for 5 days and fast totally for 2. Dr. Michael Mosley's 5-to-2 diet is similar, although he claims that you can eat up to 800 calories on the fast days and still lose weight. Another important concept in fasting is that in any 24-hour period, you should do all your eating within an 8-hour window, so that you are fasting for 16 out of 24 hours. But to get back to your original question, hypnosis can help with weight loss, And one of the most recent techniques is the so-called hypnotic gastric band, in which under hypnosis the patient is made to believe they have a real gastric band fitted. And an even newer method is the so-called hypno-fasting technique, in which the client goes on a diet involving intermittent fasting, and hypnosis is used to provide the willpower and motivation to enable them to continue with the plan.
You've mentioned the topic of compliance in your book. How much of an issue has this become in hypnotherapy?
It's a big problem. In short, if you ask people to do something between sessions, such as listening to a self-hypnosis CD, practicing their self-hypnosis, or doing some TFT tapping, then a lot of people won't do it, resulting in a treatment failure. It is not a problem specific to hypnotherapy or alternative medicine, but is found in society generally. Look at the number of people who know they should not drink and drive, break the speed limit, or use their mobile phone at the wheel, yet they still do it. A lot of people simply will not do what you tell them to do. Another related issue is the problem of people who make an appointment and then don't show up. I've had this happen many times, even though I sent clients my terms and conditions in advance of the appointment, which explained all the ways that an appointment could be cancelled, which included cancellation by text message. It's a big problem in the NHS, where up to 30% of patients fail to attend GP and hospital outpatient appointments, and it costs the country millions of pounds. Some people have suggested that there should be a £5 or £10 fine for people who fail to make appointments. I think this would be a great idea, but personally I would set the level of fine much higher, and if they didn't pay up, I would send in the debt collectors. It would be a great source of additional revenue for the NHS. You see, you can't really enforce a fine of £5 because it's not worth going to court or using a debt collector for such a small amount.
In your book, you talk about success rates in hypnotherapy and you provide detailed statistical accounts. Can you say a bit more about that?
Every treatment, including hypnotherapy, has a success rate and a failure rate. And I mean every treatment, whether alternative or orthodox, surgical or medical. For example, Viagra is only successful in 75% of men with erectile dysfunction, and the anti-smoking drug Zyban has a success rate of less than 50%. Yet, the general public has unrealistic expectations of hypnotherapy. They believe, as a result of what they've seen on TV or read in the newspapers, that hypnotherapy can cure anyone of anything, including cancer. Hypnotherapy and related techniques does have a good success rate in treating various issues, but it's never going to be 100%. The late Dr. Roger Callahan, creator of TFT, once said that if you ever meet a therapist who claims to have a 100% success rate, then it means one of two things. Either they are lying, or else they haven't treated many people. The problem is compounded by the fact that some alternative therapists have a messiah complex. They believe they can cure anyone of anything, and they make these very boastful comments on their websites, which are often full of fabrications, exaggerations, and rather doubtful testimonials. For example, I've seen some hypnotherapists who have claimed to be television presenters and broadcasters when in fact they participated very briefly in a local TV or radio program. Another very common claim is for therapists to say they are a fully qualified hypnotherapist, when in fact there is no such thing, as there is no single nationally accepted qualification for hypnotists. If I felt so inclined, I could set up the Colin Barron College of Hypnotherapy or the Colin Barron Hypnotherapy Association tomorrow, and it would have equal legal validity to all the existing organisations and training courses. Having said all that, and having had my little rant, I accept that there may be good reasons for hypnotherapists to say these things, because it boosts the placebo effect through the power of belief and expectation, and I will be saying more about this shortly.
I know that one of the great arguments that exists in hypnotherapy is whether it should be spontaneous or scripted. Would you like to say a little bit about this argument?
When I first learned hypnotherapy, I was taught that scripts were of limited value since they are so general. So if you are faced with a client who is a smoker and wants to give up, according to classic Ericksonian hypnosis theory, that person has reasons for smoking which are unique to them, and you must come up with bespoke suggestions which will work for that client and not anyone else. Now, all I can say to that is that Dr. Milton Erickson was a genius, and I am not. Most hypnotherapists are not geniuses. And by the early 2000s, I found that hypnosis scripts do work with many people. And by the time I retired, I had hundreds of them covering most problems, and I had them all laminated for easy use. I would also point out that the Valerie Austin method for stopping smoking, which has a 95% success rate, uses mainly scripted material with some interactive sections. Let me give you some examples from my own experience. Back in 2000, my mother had a facial wart. I treated her with an unscripted Ericksonian technique called cellular healing. It didn't work. 8 years later, my wife had a wart under one eye. I treated her with hypnosis using a combination of scripted material and ad-lib suggestions. The wart promptly fell off. 2 years ago, I had a wart on my forehead. This time I was feeling lazy, so I used an entirely scripted method using a script I downloaded off the internet. The wart fell off. So my own personal experience is that scripts do work, and I don't think there is any scientific evidence that they are any less effective than ad-lib suggestions, despite what many people claim. The most important factor in hypnotic success is belief and expectation, and I'll be talking more about this in a moment. Yet I have personally witnessed 2 hypnotherapists ranting about people who use scripts. One of them was a well-known trainer, and I actually got a phone call from someone who went to see him. He used an ad-lib method and it didn't work. So I don't think the real issue here is whether hypnotherapy is performed using a script or spontaneous utterances. It is whether the client is cured or not. I would rather fix the client with a script than fail to help them using spontaneous utterances. And I think the problem is that many top hypnotherapists are very big-headed and their egos won't let them use a script. And indeed, there is one situation in which I would never use a script, and that is when a third person, usually a friend or relative of the client, is sitting in the consulting room witnessing the treatment. In such a case, I would use entirely ad-lib methods, because I agree that it doesn't look good if you are seen to be using a script. Another point about being spontaneous is that many hypnotherapists who don't use scripts actually say more or less the same thing to all their clients. So they are using a script. It's just that it is a mental script, not a written one. We all have the tendency to use the same words, phrases, and sentences when we talk. So nothing is ever really truly spontaneous.
So what part does belief and expectation play in hypnotherapy?
Belief and expectation plays a very important part in the success of hypnotherapy. In fact, I would go so far as to say that it is probably the most important factor in hypnotic success. In short, if you believe and expect that a treatment will work, then in many cases it will do so. A good example would be warts. Warts are benign tumours caused by a virus, which have a very slender grip on the body. They are highly susceptible to any kind of placebo treatment. Back in the early 70s, the Greenock Royal Infirmary had a machine for treating warts in children. It looked like a prop from Doctor Who. Children would put their hand in a compartment where it would be bathed in coloured light. Lights would flash, levers would be pulled, and the machine made an electronic noise. Very often the treatment would be effective, but the machine only worked with children, and I think you can guess why. Adults would see through the deception and would not believe it could work. What I've just described is a placebo treatment, which works through the power of belief and expectation. Yet placebo treatments can be very powerful. Recent research has shown that if you give people a dummy painkiller, which they believe to be a real drug, then endorphins are produced in the body, as though a real pill had been given. Placebos will even work if the patient knows their true nature, although their success rate is then obviously less. There are ways that the hypnotherapist can boost the placebo effect, increasing their success rate. For example, I would always wear a suit, shirt and tie when seeing a client. And the wall of my consulting room would be about 30 framed certificates with all my qualifications. There would be a felt notice board covered with newspaper articles about my successes. And there would be bookcases full of books on psychology, medicine and hypnosis. There would even be a stethoscope hanging on a hook on the back of the door, just to remind people I used to be a doctor. All of this was done to increase the placebo effect, to create belief and expectation that the treatment would be successful, that whatever I said to the client in hypnosis was exactly the right thing to fix their problem.
Now, phobias are something that many of us will have to deal with in our lives at some point. Can phobias be treated with hypnotherapy?
They certainly can. I think it's fair to say that there are more techniques for treating phobias using hypnotherapy and related techniques than there are for almost any other issue, and I have listed them in the book.
Now, if hypnotherapy and related techniques have such proven effectiveness, why are they not generally used in the NHS?
That's a very good question. First of all, I should like to explain that the sort of problems that psychiatrists treat are mostly things that cannot be helped with hypnotherapy. For example, psychotic illnesses such as schizophrenia, personality disorders, bipolar disorder, and so on. The sort of problems that hypnotherapists treat, on the other hand, are those which would usually be treated within the NHS by clinical psychologists and registered mental nurses. Clinical psychologists have a very lengthy training period, which is sometimes even longer than the time taken to become a consultant in medicine. Although they have a great knowledge of psychology, they tend to use old techniques, which have a very poor success rate. Furthermore, they usually have to wait a long time to see a clinical psychologist. Unfortunately, most clinical psychologists have a very negative view of hypnotherapy and other related therapies. They claim it is not evidence-based. In other words, there are no double-blind controlled trials which prove its efficacy. And if we take GPs, who are the first point of contact for people suffering from psychological problems, a small minority of GPs have done training in hypnotherapy with the British Society of Medical and Dental Hypnosis and perhaps other organisations, and so would be in a position to give an accurate opinion as to whether hypnotherapy would work for a particular condition. But most GPs have not done such training, and their knowledge of hypnotherapy is probably no greater than that of the general public, since hypnotherapy is not taught at medical school. So most GPs can really only give an emotional opinion as to whether hypnotherapy might work. I was once contacted by a potential client who was considering thought field therapy treatment for her panic attacks, and she went to see her GP for advice. Bad mistake. When her GP discovered she was planning to see me, he launched into a highly emotional tirade about me and how I was a con man and how TFT couldn't possibly work. But he didn't offer her any alternative. And this leads me on to another topic, referrals from GPs. There seems to be this myth promulgated by some hypnotherapy trainers that GPs make lots of referrals to local hypnotherapists. This is totally untrue. When a patient goes to see their GP with a psychological problem, then the GP is supposed to refer them for treatment within the NHS. In the same way, if a patient goes to their GP with back pain, the GP does not refer them to a local private chiropractor. They offer them treatment within the NHS. In the 17 years I was in hypnotherapy practice, I only ever received a few referrals from GPs and psychiatrists, and usually they were special circumstances. For example, the patient had already received orthodox treatment and it hadn't worked. They wanted hypnotherapy and they had private medical insurance. I have never received a referral from my local GP practice, even though they knew I was medically qualified. Having said all that, hypnotherapy and related therapies such as TFT, EFT and NLP are used here and there in the NHS, but not in any widespread fashion. I think it would be a good idea if hypnotherapy and related therapies could be offered routinely in the NHS. But I think the hypnotherapy profession will have to provide the evidence-based research that psychologists and psychiatrists would be looking for.
So Colin, thank you very much for joining us today. I very much appreciated you taking the time to discuss your book and its contents and talking about some of the subject matter that you've addressed throughout it.
Thank you, Tom. And Practical Hypnotherapy is available from Amazon and other internet book sites.